We need
Yeah.
more data. But when we come into the office, and when men come into the office and they're depressed, are they going to go through this process of elimination?
That's
Or
cool.
you're going to do the questionnaire, ask them what's going on, you're going to do the blood test?
Yeah, we're going to look at that. Currently, I have a couple of patients that have prostate cancer that see me, and we're treating them the way that you should be treated with estrogen and whatnot, and they're doing well. I mean, one of them, his physician, who's a urologist, recommended that he don't do any surgery, and he's actually okay with the treatment that we're doing, and the patient's doing great.
That is music to our ears.
So, yeah.
It really is, because my next question to you was, if we do have prostate cancer, is it too late when we come to you?
No. Mm-mm. No.
This is great. This is great news. Yeah.
I'll take anybody with prostate cancer because I know what we needed to do to treat it.
Because it's a brutal way that they're treating it,
Yeah, that drug, those drugs, and not to knock the pharmaceutical companies, they've done really good drugs but their cancer drugs have missed the point. One of the big sayings in this medicine is, especially related to cancer, we cured the cancer, but the patient died. We cured the cancer, but the patient's quality of life is crap. Why? We get focused on curing that cancer. And I understand cancer. When we hear the cancer word, it's bad. People freak out. But if you're going to destroy your quality of life, and I hear this day in and day out with patients that have had cancer, they see how their parents had cancer. They go through this treatment, and they say, okay, I'm going to go gung-ho at the beginning, and then all of a sudden, the drugs that they're on, the chemo, the radiation, the bodies break down. And I've had patients say, no, I don't care if there's even a 20 or 30% chance of curing. I don't want to do this. Well, this stuff is killing me. And,
quality of life.
yeah, it's quality of life. If we can find alternative ways, like, for example, treating men with estrogen, which we've done in the past for prostate cancer, especially it's metastatic prostate cancer is what you use estrogen for in that situation, meaning it's throughout the whole body instead of just in the capsule, because you don't need to do that as long as it's in the capsule. When you treat them with estrogen, and it's going to improve their quality of life because they're going to reduce the risk for osteoporosis, and they're not going to get hot flashes and night sweats because you're not reducing their testosterone and estrogen, then we should do it, because it's also going to kill those cancer cells. It's going to reduce the burden of the cancer cells. It's going to reduce the blood supply to cancer cells. So it's unusual to sit there and say, hey, we only can do these medications. This is the only way you should do it. This is it. This is the standard of care. And this is all we do, because some company said that their drug is better than a traditional way, or not even the traditional way. This has been used before, and so we throw it out because we have these other drugs. It doesn't make any sense.
Well, all we